Welcome to HealthCall Live Online, where we feature extended interviews featured on our weekly radio broadcast. My name is Lee Kelso. Today we're talking with Dr. Alexandria Coronado Hughes in Orange County, California. She and her husband have just recovered from COVID-19. Dr. Hughes, thanks for joining us.
You're welcome. I'm glad to be here.
So I'm glad that you're here. How's your husband doing?
He's much better. I knew 2 days ago he was better because he was singing and watching baseball. So there you go. I knew my husband was back.
That's great. That's great. So you were in Baltimore, and do you think you picked up the virus there, or was it on the flight across country?
We're not sure, and I don't think the doctors are sure either. But we went to visit my husband's sister who was on hospice, and she passed away a week ago Sunday. So I'm glad we went back there, whatever happened. And I'm glad we got COVID-19 early. Quite frankly, we were in the first 100 people in Orange County to catch this.
Well, that's an honor no one wants to claim. Tell me about
Right.
how it felt when it came on and exactly what that process was like.
So we returned home Sunday night. On Monday, I had this weird feeling in my throat, and I thought it was time to change my electric toothbrush head. You know how your toothbrush heads get dirty, and then you think, oh, it's time to change a toothbrush. And that's what I did on Monday. By Tuesday, I was extremely ill. I was running a fever. I was not feeling well, and my husband had become ill on Monday. And so I made him go to the urgent care on Tuesday. And for whatever reason, they did not test him for COVID-19. They tested him for the flu, and then they sent him home. On Wednesday, I woke up and I was running a fever. It was about 101. And so I went over across to the urgent care and asked for the COVID test. And they said yes. And they also tested me for flu. And my flu test came back negative. And then it turns out we were both positive for COVID-19. On the Friday that week, I took my husband back to urgent care, and the doctor asked me to make sure that he goes straight to the hospital emergency room, and my husband was hospitalized.
What were his symptoms? Was he having the difficulty breathing?
So a big tip off was that he was sleeping about 20 hours a day, and I couldn't get him up. He just didn't have any energy. I couldn't get him to eat. I couldn't get him to drink. And I was sick also, but I knew in my head that I needed to make sure that he was drinking and eating and hydrated. And it was really hard to get him to eat anything at all or to drink. And part of that is because COVID-19 takes away your sense of taste and smell. And I think it creeps on in this disease, and people don't realize that's what's happening. And that's why people are becoming so ill.
Yeah, I just saw a report today that in Europe, they're saying now 59% of the COVID patients lose sense of smell. So yeah, a real significant symptom from all of us to watch out for. So tell me about the therapy. Were you offered any of the medications that you're hearing about, the chloroquine or anything else?
So my fabulous Dr. Steindler at Hoag Urgent Care over here across the street from our house actually gave me Tamiflu for whatever reason and sent me home. And that's the only reason I was able to take care of my husband. That cut my symptoms by about 50% the next day. So I started taking it Wednesday night. And by Thursday morning, I was already 50% better. So I didn't have nearly as bad a case as my husband had. But I'm not sure if that was the Tamiflu, because I spoke to my pharmacist about that, and she said that should not have worked because the molecules are different, and I don't understand the ins and outs of all of that. But she was explaining to me the molecules are different in Tamiflu than what is in the coronavirus. And so it shouldn't have worked. And I said, well, it did. It helped cut my symptoms by about 50%. And that's why I was able to take care of my husband.
Yeah, I don't understand that either, but I'm certainly glad it worked. And tell me about the aches and pains. I've heard that it's just horrible. Did you experience that or your husband?
I did. So the pain kind of starts when the fever starts. And it feels like you don't want anything to touch your skin at all. I didn't even want to take a shower, and I'm a person who showers. But I didn't even want the water touching me. Blankets, no clothing. there is this, it's a very strange feeling on your skin,
Hmm.
like a million needles being in your skin. It is a horrible feeling. So this is definitely not a flu for people who are saying this is like the flu. It's not that at all.
Did acetaminophen help you at all? Did you try that at all?
We did actually. The hospital told us to stay away from ibuprofen.
Mm-hmm.
I don't know if that's because that was a rumor going around or if that's really happening with COVID, but we took Tylenol the whole time, acetaminophen the whole time.
Yeah, the French health minister at one point said that there was some evidence that ibuprofen was aggravating the symptoms. I think that's been kind of recanted now, but what the heck, acetaminophen's available, it's inexpensive, and if it works, it works. Why take the chance? So your husband, tell me about his severity of symptoms once he was hospitalized.
So he turned out on his x-rays and his CAT scan, he had symptoms similar to ARDS.
Mm-hmm. Which
And
is
it was
acute
not,
respiratory distress syndrome, which can often be fatal.
yes. And we were very worried about that.
Yeah.
He did not need a ventilator, thank God. Thank you, God, for that. He didn't need that. He had to have, he had 4 bags of IVs put in him because he had sepsis in his lungs with this ARDS.
Yeah.
And so then they put him on oxygen and he was better within 24 hours and able to come home. And I'm so thankful to the doctors at Hoag Hospital that they were able to treat my husband quickly, efficiently, and get him home. There were some interesting problems, though, when he came home. So the nurse called me and told me he was ready to leave the hospital and that I could come and get him. And I said, no, I can't. I have COVID. I can't leave my house.
Yeah.
And she said, oh, well, we'll put him on the Uber. And I said, no, you won't. He has COVID. I said, are you telling me that there is no transportation for these patients going from the hospital home with COVID? And she said, that's what I'm telling you. And I went, oh my gosh.
Wow.
So all these little tiny nuts and bolts of this disease, as it escalates here in Orange County, California, at least we're able to help people because we have now all the contact listings and we know people that work in the different supervisorial offices, and we can call and point these strange little things out that I don't think people around the country have thought about yet.
Yeah, I never thought about that transport home. That's a great point. So now you theoretically are immune if you're beyond your contagious state.
Yes.
And so are you no longer subject to restrictions in California? I would think that's the case.
No. I am. We are following all of the restrictions. I'm just going to the grocery store. When I go to the grocery store, I'm wearing gloves, I have on a mask, and I have on my sunglasses because we've heard this virus can come through your eyes. Also, like any soft tissue on your body, it can come through that. And I certainly don't want to ever get this again, even if we do have antibodies. And I know that people are looking, there's 36 hospitals, I believe, I read in the Wall Street Journal just last night, that are looking to do the antibodies and take people who have recovered, like I have and like my husband has from COVID-19, to take the plasma from the blood with the antibodies and give it to patients who are ill. And my husband and I have been asking all week long who's doing that in California so we can send our antibodies off, and nobody seems to know. So if you know, I'd love it.
I don't know that, but that is a great question, and I will make note of that and see if we can follow up. I do have a ICU hospital contact out there in your area, so I'll check and see about that. Leave us with a final thought on this. It sounds like an experience that none of us want to have. What do you think was going to make a difference for us? What could we do to make this experience less awful?
I think you need to stay home. Nobody wants to get this. I certainly don't want elderly people to get this disease. It's pretty tough to go through it by yourself if you're at home by yourself because you don't realize the big thing, and I can't stress enough, the big thing is that you lose your sense of taste and smell with this disease. And you have to keep eating and drinking even though you're so sick. You really will end up in the hospital if you don't keep eating and drinking at least a little bit. I cannot stress that enough. And it creeps up on you and you don't realize that's what's happening to you in this disease. So if you come down with these symptoms, if your mouth starts feeling funny, if you start running that fever, it'll kick in at about 99 degrees Fahrenheit. And if you just start getting those symptoms and then you start hurting the next day and you get those pins and needles, you need to be conscious of the fact that you have to eat and drink something to pull yourself through this.
Great advice. Good input. Thank you so much, Dr. Alexandria Coronado Hughes. Best of luck to you and your husband in your recovery.
Thank you so much, Lee. It's great to be here. Thanks for having us.